Hello, my name is Alina Ajit, and this presentation will discuss if medications like mood stabilizers and antipsychotics should be used to treat bipolar disorder in pediatric cases. Based on data that has been collected, mood stabilizers and antipsychotics should not be used to treat bipolar disorder in children today. Multiple factors must be in consideration before ever giving a child medication that can affect their body as well as well-being at such a young age. One big reason why medication should not be used to treat bipolar disorder in children is the fact that not much research has been found for these medications in children specifically. As stated in antipsychotic medication prescribing trends in children and adolescents, little information has been found on the long-term effects for children as they are still developing. Although these medications like second-generation antipsychotics have helped to reduce things like aggression, mood swings, tantrums, irritation, and agitation, it has caused side effects like increased hunger, tiredness, and even higher chances of having high blood sugar, lipids, or fats in the blood, higher production of prolactin, or even diabetes. Children are taking drugs to combat the side effects that they are facing from the initial drug, and it slowly becomes a negative spiral. In the instance of Jacob from the medicated child, he was given Ritalin for his ADHD, which then made him anxious, so he took another drug, which would then cause another side effect, where another medication was needed until he was on 8 medications. Physicians must understand how mixing medication can negatively affect children before prescribing them. Many children are being misdiagnosed with bipolar disorder. In the last 2 decades, there has been a significant increase in the number of children being diagnosed with this disorder. When defining bipolar disorder, it was in regards to adults, not children. So the characteristics that are identified in adults are the baseline for diagnosing children, which must be altered to fit for children. Once these children get diagnosed with bipolar disorder, they're given medication to fix their behavior. However, if misdiagnosed, they'll be taken medication that they do not need. Medication should not be the first solution when diagnosing children, as this can negatively affect their brain, body, and overall health, and very little can possibly be done to reverse it, let alone finding the correct solution if the diagnosis is incorrect once the damage is done. When a child is taking medication for bipolar disorder, it can be easy for them to overdose, as children tend to be unreliable. For instance, an amber vial cap has a child safety lock to make sure children do not get their hands on medication. If a child is taking Ritalin or lithium, it can be fatal if too many are taken. As stated by Burke and his peers, patients have misused illicit drugs countless times, and this can easily happen to a child. As for the future direction of trying to help children with bipolar disorder, there should be some discussions of cognitive behavioral therapy available to children, as well as more clinical research on medications for children who have this disorder before physicians can prescribe them. New guidelines should also be followed that fit for children as opposed to adults when diagnosing this disorder that are consistent. All in all, medication for bipolar disorder should not be the solution for children. A lot more research and knowledge on this topic must be followed and found before being able to push these drugs on children, as there are too many negatives to be using these drugs.